Hi, my name is Nick Bobinger. I'm a physical therapist and sports certified specialist at Orthopedic 1. In collaboration with Menino Grand Slam here in Dublin, we offer a free baseball injury clinic to evaluate any issues that you might be dealing with. Due to the condensed season, due to the COVID restrictions, and in prior seasons, we have had some issues with some overuse injuries in our baseball athletes. Thus, today we want to kind of go over some preventative exercises and things that our athletes can be focusing on to make sure these injuries do not continue to occur in their season. Most common injuries that we're dealing with our baseball and softball athletes tend to be overuse injuries to the shoulder and elbow. A few examples of these injuries would be little league shoulder, labral tears, rotator cuff tendonitis, shoulder impingement, little league elbow, medial elbow pain, bicep and tricep tendonitis, and forearm strains. Most of the injuries we tend to see in the throwing motion are going to occur from the acceleration phase into ball release, which puts a lot of load in the posterior aspect of the shoulder to be able to decelerate the arm through this motion. Due to this, we'll be focusing a lot of our strengthening on that musculature group to be able to have the endurance and stability to be able to assist in this movement pattern. So for our exercises, we're going to first start off focusing on some flexibility, looking at our shoulder range of motion, particularly in internal rotation, as this is a motion we will lose throughout the throwing motion. For this, I have two stretches that I will demonstrate for you, and I just want to specify that we should not feel any pain in the front side of our shoulder with this. The next two stretches will be focusing on the flexibility of our posterior shoulder, particularly our rotator cuff and our posterior capsule. This is to restore the range of motion that we're losing throughout the throwing motion to be able to allow our arm to make it through the acceleration to ball release phase. For this, I'm going to need you to lie on your side, either on the ground or on a table. Place your arms straight out at shoulder height. Place a dumbbell up against your upper arm to block the arm. And then from there, bend up the elbow till pointed up towards the ceiling. In order to do the Genie stretch on the handout, cross your arm over top and grab the top side of your elbow with your other elbow on top of your hand. Do not grab on like you instinctively want to. Make sure you stay stacked this way. From here, lift straight up towards the ceiling until you feel a stretch on the outside of your shoulder. Hold for 20 seconds, and then lower down and take a 20-second break. And then repeat this for 5 reps. The second stretch, referred to as your sleeper stretch, you will grab from the back side of your wrist, place your chin on your shoulder, and rotate your palm down towards the ground until you feel a stretch. Similarly, we will hold this for 20 seconds, and then rotate back up to take a break, and repeat for 5 reps. The next series of exercises is going to focus on the strength of our posterior scapular muscles, which are going to be very important in the deceleration phase of our throw. In order to do this, you're going to need a Physio Ball, or you're going to have to lay off the side of your back. The nice thing about the Physio Ball is it allows us to be able to work on both arms and some core stabilization at the same time. With this, I want you to place this into your waist, roll out till your knees are straight and your body is in a plank position. From here, your arms should hang over the front side of the ball. From here, we are going to reach back and make an I with our arms, hold for 2 seconds, come back down. Next, go out to the side and make a T, hold for 2 seconds, and back down. 45-degree angle, hold for a Y, 2 seconds, and back down. And the last one is a W. Put your hands up, elbows back, hold for 2 seconds, and down. Repeat these for a series of 10 to 20 reps based off fatigue, and then take a break. And we're looking to get 3 rounds based off fatigue. Feel free to reach out to our Sports Medicine Hotline for a no-cost consultation with one of our certified athletic trainers at Orthopedic 1.